Again, if you're just joining us here right now, we'll be getting started with our event in just a moment as we wait for audience members to join us. So we'll be getting started shortly. Thank you for your patience. All right. Hello, everyone. Thank you again for joining us today for the Healthy Minds, Healthy Kids Children's Mental Health Community Speakout. Today, during our event, we are bringing everyone together so you can join with other advocates, caregivers, youth service providers, and state leaders to call on New York State to make the needed changes and investments that prioritize children, youth, and families amid decades of chronic disinvestments in children's behavioral health system. You're about to hear from a number of different speakers, a part of our Healthy Minds, Healthy Kids campaign, and advocates like you throughout the state, sharing a number of different experiences that highlight what is at stake with our children's mental health system, how we are taking action, and the priorities that we want to advance at the state level to ensure that we address these critical needs and investments that our children, youth, and families deserve. So I will hand it now to Diane Tanner, who is our Healthy Minds, Healthy Kids Council leader and a parent and advocate in New York State. Diane will introduce us to our event, highlight what we will take you through the next hour or so, and lead us into why this is a critical moment for us to come together, mobilize, and fight for change. So Diane, take it away.
Good afternoon, everyone. My name is Diane Tanner, and I live in Rochester, New York. I'm a parent, grandmother, great-grandmother. I retired 3 years ago and always worked as a customer service rep on the phones, taking care of my second oldest daughter in 2020 for 8 months, and also my artistic grandson, had me not just being a parent or a grandparent, but also a caregiver. The love I have for my family gave me the opportunity to share my love for others that needed help, supporting others that had special needs and mental health issues. I found that I was not alone in dealing with the challenges I faced by many and receiving the support and services so our loved ones can thrive. For example, back in Rochester, my mentor for over 20 years had a daughter with mental health issues, but couldn't find the resources to support her. From a provider that looked like her and experienced wait lists to get the services that was needed for her daughter. She eventually found the organization BIPOC Peak, which means Black Indigenous People of Color, parents elevating their voices to educate and empower each other, eliminating the disparities and inequities in the emotional service of our kids. As an advocate, I go into schools, rec centers, libraries, bringing resources about being a mental health advocate for needed services in our communities, providing training on what the impact of trauma or stigma is for the broader public. I have advocated with the Children's Agenda, was on the front line with the Office of Mental Health, Substance Abuse of Monroe County, and also one of the leaders of the Healthy Minds, Healthy Kids Youth and Caregiver Council. I do this work so that I can let people know that our voices do matter. Today, I have the honor of introducing you to who we are. The Campaign for Healthy Minds, Healthy Kids is a statewide coalition dedicated to ensuring every New York child gets the high quality behavioral health support they need. We develop policy, priorities, and advocacy strategies through the collaboration work of our steering committee and Youth Caregiver Council, which I am a leader of. The Healthy Minds campaign includes family and youth advocacy organizations, mental health providers, community and hospital-based clinics, and other committed experts and advocates. We want to create the political will among our state leaders to address the children's behavioral health crisis. For so long, our state has deeply underfunded our mental health system, and children and families have suffered as a result. You are going to hear from many speakers today about the needs in our state and the potential solutions. We need every one of you to join us and raise your voice for children in the state. In the chat, we are including information for how you can take action and get connected to the campaign. Thank you. Diane Tanner, I'm a Healthy Mind Council leader.
Thank you, Diane. So like Diane introduced for us, today we're going to take the time in two different segments to highlight why we are here as a campaign and why we are bringing you all together and highlighting what is at stake in the children's mental and behavioral health landscape. For our next segment of this event, you're going to hear from a number of different speakers talk about a number of different issues, including providing a framing for what is happening in the children's mental and behavioral health landscape. You'll hear them talk about data that highlights the crisis happening in our mental health work. You'll hear a number of different issues that families, parents, and caregivers are experiencing or have personally experienced. And you'll hear about what it looks like when we do invest in mental health for children and youth. Our first speaker, also part of our Healthy Minds, Healthy Kids, Youth, and Caregiver Council, Faith, is now going to talk a little bit about her own personal experience with herself and her daughter. So Faith, I'll hand it off to you.
Good afternoon. My name is Faith Beatty. And like Diane Tanner, I also live in Rochester, New York. I'm a council member with Healthy Minds, Healthy Kids, but I'm also an educator in the school system. I also work for a nonprofit that is centered around children. I speak today as a mother of a child with mental health issues. It is very difficult to access services because of funding and a lack of providers. I am one of the lucky ones because I have learned to navigate through the system. Right now, my child is in a residential treatment facility. And it's the hardest thing for me to have to go through. I'm sorry. But I am not navigating the local system now. I am navigating the state system, and that's not easy. I've done everything that I can because of my daughter. I do the work that I do because of my child. She has opened my eyes and impacted me in a way that nobody else ever could. I don't always feel like I get what I need, but it doesn't stop me from advocating for my child or other children as well. The work that I do on a daily basis with my kids at school means a lot as well. I see the struggles that they go through and the difficulties that parents have because of the system. The system has failed our children, but we as educators, parents, and communities will fight until New York State does the right thing to make sure that all of our children have the best quality mental health possible. I also want to touch on the proper housing that impacts our children and their mental health. Children that don't get enough sleep come to school tired, and most times they are hungry as well. Although they receive breakfast and lunch at school, it truly isn't enough. New York State has become really lazy at providing these things for our children. Even me as a single mom cannot get enough food at times for my child. I work, everything comes out of pocket, and I still struggle. Proper food, sleep, housing, and education impacts our children. This is not just a parent or a school issue, it's a human issue. And our children need to know that they are the future. And with the proper help, they will succeed and be able to advocate for themselves as well as someone else. They need to know that they are our future and that we are so very proud of them, their accomplishments, and the fact that they are not always, but sometimes willing to work on their challenges. I will leave you with this quote. Beneath every behavior, there is a feeling, and beneath each feeling, there is a need. When we meet that need rather than focusing on the behavior, we begin to deal with the cause, not the symptom. So even though I speak as an educator, I truly do come to you as a parent who has had a hard time as a single mom, but who has also strived to make sure that her child has what they need. I sit here in front of 3 kids here at my school right now who need help. And because I love them like my own, I will make sure that I try and do the very best that I can to make sure that they have what they need. I appreciate your time. I appreciate you listening today. And I hope that you're impacted by everything that we all have to say today. Thank you.
Thank you, Faith, for both sharing the vulnerability and having the courageous energy needed to not only deal with the issues that yourself, your child, and many other families are experiencing, but also then committing to advocating and working to really make sure that the experiences that you and others are going through do not continue to occur in our state. So I appreciate you. Know that we are here with you and standing with you. We will uplift you as well as all the other parents, caregivers, and families that are experiencing similar and different circumstances like you are. But know that we are here for you, and we appreciate the time you've taken to be committed to this work and to really be a driver for change that we're wanting to push through. So next, we are hearing from our second council leader, Preem, who will go on to share their personal experience and connection and highlight from their perspective what's at stake for New York's children and youth. Preem, go ahead.
Hello and good afternoon. I hope that all of you can hear me. I'm currently in my studio that's located in the main branch of the library of the city of Albany. By trade, I am a media communication technician, which means I work with a lot of cable companies, Spectrum, and different people to get community content out. And a big topic for most of my producers is definitely the dignity that comes with support from advocacy. We all work really hard with the council to advocate for not only children, but also their families, because it's a package together. It's very hard to work with just the child and not the parent. And the healing of the family is very focused on working with the parent and the child. I live in the city of Albany. I've been living in the city of Albany since 2001. I've learned many things by living here. This is the powerhouse of policy for the whole state. Every year, people in my community, we watch many different people from many places come to our community to make change. It was very important for me to join the council because I wanted to be one of those folks that made change that live in the city of Albany. I'm currently a stakeholder in the city of Albany, a property owner. I am a coach for Team USA Boxing, as well as a Section 2 basketball coach. So I work with many different youth from different school districts. I'm also contracted by the school district for my trauma-informed art class called Our Art Class LLC. I joined the council from a Speakout. It's kind of like the town hall that we're doing here that talked about behavioral health. The 2 sons that I have are 14 and 15. I shared them with a partner. And when they were very young, they were diagnosed with ADHD as well as ODD. And there were limited services for them for the clinic that came to their school. We fought, me and their mother, very, very hard to get all of the supports that we needed within our Albany City School District elementary school for our 2 kids, which were a year apart, or are a year apart, 14 and 15. We had to work to make sure that they had all the supports that they needed. What I found personally was that recreation helped to change youth outlooks. As Faith was saying, many youth do come to school hungry. Many youth do come to school with conditions that affect their mental health, past any type of hereditary things that are going on. And it's very important that the council has these town halls to talk to parents, talk to families, talk to organizations, and discuss how we can create solutions. Solutions look like less suspensions. Solutions look like more fed kids. Solutions look like less in-school suspensions. Solutions looks like more communication with parents and families, and not forgetting about these youth that are growing steadily into older adults. The council is very important to me because as I'm advocating within these meetings, however many hours per week, I am definitely projecting that into my City of Albany world and bringing back everything that I'm learning here and practicing here with the students and youth that I work with. I'm 36 years old and I work with about 500 to 800 youth per year with the organizations that I work with, and I'm happy to work with our collective here at the council to be able to spread this message so that we can help to support and develop stronger young adults and stronger families and all, because we're all hurting, but the healing comes from the advocacy as well as the community that's created. And I think that counts. I thank our council for allowing me to speak today, and I don't want to drag it out. Thank you very much and enjoy the town hall.
Great. Thank you, Prem, for those powerful words and really highlighting for us the arc of what we as a council and a group want to accomplish, and the passion and the energy required to do this work on a daily basis. We, as Prem said, we as a council formed really because there are so many passionate advocates and advocates who on a daily basis strive to make change for the better in the lives of children and families. And now I think, we are at a pivotal point where we have leaders like Prem, leaders like Diane, and leaders like members of the rest of our council who are really ready and able to activate other groups, other partners, and really call for what is needed of our state leaders. Next, we will now be passing it to Alice Bufkin, who is the Associate Executive Director for Policy and Advocacy at Citizens Committee for Children of New York. Alice is going to very nicely, I think, thread all these points that have been raised by our first three council members that you've heard from today, and start to make the connections about the impact these issues are having on our children and youth before we go on to talk about what is it that we want to see accomplished, what are the policy changes and recommendations that we're going to move forward with. So Alice, I'll pass it on to you.
Thank you, Carlos. We here at Citizens Committee for Children, along with Families Together New York State, the New York State Coalition for Children's Behavioral Health, and Long Island Families Together, we help support this Healthy Minds, Healthy Kids Youth Caregiver Council. And I'm, incredibly proud and moved to be here speaking with so many fantastic members of our council and advocates for their own families, as well as the entire community of New York. And I really appreciate being here. You've already heard from Diane, Faith, and Prem a little bit about the depth of the children's behavioral health crisis in our state. And from our next speakers, you'll be hearing more about the impact of this crisis on families, as well as some of the really desperately needed solutions in our state. What I want to do is put a little bit of this in context. As some of you may have seen, a CDC report just came out yesterday, finding that the number of deaths by suicide in this country have reached record levels last year. In New York State, death by suicide is the third leading cause of death for young people aged 15 to 19. We know that about half of youth with major depressive episodes in the state didn't receive treatment last year, and that 35% of young people who are discharged from a psychiatric stay at a general hospital end up back in an emergency room within 90 days. These are just some of the statistics, but as you'll hear throughout today's program, it's the stories of individual children and families that are behind each of these data points. We are deeply appreciative that we have a governor who has stated her commitment to children's mental health. Just today, her office announced $5 million investment in school-based mental health clinics. That funding is greatly appreciated. It's desperately needed. But we also know that the mental health challenges in our state are deep-rooted and systemic. They require significant long-term investments across the continuum of children's behavioral health services. What we know is that children throughout the state are sitting on wait lists for months, for 6 months, for a year, for longer to get services. What we know is that parents' entire lives are consumed by trying to get their children the care they need. What we know is that we don't have the workforce necessary to meet the needs of young people. And as a result, we have children who are cycling in and out of emergency rooms and hospitals, and then they're becoming adults with even more complex challenges. It doesn't have to be this way, because what we also know is that when we invest in the right services for young people, they can flourish. When we provide children with the full continuum of high quality supports they need, from preventive services to high acuity care in schools, in communities, and in clinics, we can change their futures, and we can change the future of the state. All it takes is the political will of our state leaders to say enough is enough. Our state has underfunded mental health for decades, and families are suffering as a result. What you'll hear in the rest of this program are more stories of the challenges families are facing, but also some of the solutions that are needed to help create a behavioral health system that truly works for children and families. We hope you'll join us and add your voice to this advocacy and join us in this important work that we do. And so with that, I'm going to turn it back over to Carlos.
Thank you, Alice. As Alice highlighted, our next segment really is going to focus on how we as advocates can urge and pressure the state to invest in children's behavioral health care in this year's upcoming state budget. I am first going to pass it to John Caston, who's the Chief Strategy and Innovation Officer at the Jewish Board, to highlight for us our first out of 4 priority areas related to what we as the Healthy Minds, Healthy Kids campaign will be advocating for in the fiscal year 2025 budget. You'll hear from John the development of a first-of-a-kind study of reforms needed to address rate inadequacy and workforce shortages in programs in New York State. So John, I'll pass it on to you.
Thank you, Carlos, and I'm honored to be part of this panel. I really want to thank my colleagues on this event for sharing what they've already shared in terms of their personal experiences, and as well as the context that Alice has sort of shaped. And I have the unenviable task of explaining a rate study and a rate request that we've developed here at Healthy Minds, Healthy Kids, along with some experts in healthcare finance that we are hoping that the state will respond to. So I'm going to share my screen and we'll talk a little bit about this rate study, what we learned from it, and how you can help really to help us promote this work. So I think the problem really actually has been described. We have, on the one hand, tremendous need for services for kids and their families, and we have an inadequate supply of in terms of workforce to respond quickly and efficiently and compassionately to the tremendous needs that have again already been expressed today. And this is a long-standing problem, but it has gotten worse. And the rates of reimbursement that the Medicaid system, which is what how the state reimburses for many of these services, are just inadequate. They've not kept up with the cost of hiring workers, have not kept up with inflation, cost of living, and all of those things. And so we have an inadequate supply of social workers, therapists of various kinds, nurse practitioners, child psychiatrists, and other folks who work in programs, peer support and family support workers, and others. So we got together, a group of us, a work group, and over the couple of months, we developed a rate study, and it's really a rate request to the state, and it has a number of components. And the context for the rate study is, I think, sort of articulated very well in this slide, which talks about the fact that when we work with children and their families and caregivers and in mental health, we're actually working with not just the children and family, but with a number of systems which children and families often interact with, whether it's the school system, the pediatric health system, child welfare system for some folks, a shelter system in some instances, juvenile justice and others. And that requires a tremendous amount of work that really is not accounted for in the way in which we are reimbursed as providers. So we got together, again, a work group of folks from different perspectives, family advocates, provider folks like myself, and clinicians and others, and met with Health Management Associates, which is a consulting firm, and they helped us develop a set of recommendations. And I'm going to just try to very quickly and concisely explain what this rate study showed and what we are advocating for, and hoping that today's launch of this rate study will result in some positive change in the way in which these services are paid for by the state, by the Medicaid system. So just so folks, to give a little bit of context, so the way that community behavioral health providers are paid in the Medicaid system is through what's called the fee-for-service system. So we provide a service and we get reimbursed a certain amount. And those amounts are developed by the state, and sometimes they're increased year to year by inflation. Often they're not. And so one of the things that we're asking for immediately is there be a 3.2% trend for children's behavioral health clinics, so that those rates are increased by 3.2% for children's behavioral health clinics, which are the mental health clinics that many folks around the state utilize, as well as two specialized programs, smaller programs. One is Home and Community-Based Services, or HCBS, which is a specialized program for children with heightened needs, and CFTSS, which is Child and Family Treatment Support and Services, which is a program that provides some more flexible interventions, including being able to have family support and peer support workers work with children and families, as well as for clinicians to go into the community and homes and get reimbursed for their work. And so those two kind of sets of services really represent a significant piece of what the outpatient mental health services for children are in New York State. So that's the sort of the first immediate piece, and really something that is is desperately needed in order just even to keep up with inflation are these increases, which, as you can see, the amounts that this would require in this coming year's state budget. In addition, one of the things that is often overlooked is the fact that many individuals, children, and their families interact with care managers, care coordinators, either through their managed care company, through hospitals and interaction with hospitals, with health homes, which is a program that New York State set up to help individuals and families navigate what's an often very complex healthcare system and a very complex behavioral health system within that. And so we identified the fact that the cost, if you will, of clinicians, therapists, psychiatrists, others interacting with all of these various coordination entities takes up time that is not reimbursed as part of what we're paid for an individual or group therapy session or a psychiatric or nurse practitioner session. And so we're requesting that a $7.50 per month payment be made for children and families who are being served in the system in order to account for the fact that these care coordination efforts and the working back and forth with care coordinators takes up time that could otherwise, again, be utilized for direct services. So that's another, as you can see, about $20 million of services that we're projecting, of reimbursement that we're projecting that would be paid to providers. when they're working with a child and children and families. And then the third piece of this is what we're just considering as a rate adjustment. The underlying reimbursement rates that are used by the Medicaid system to pay us are just inadequate for all of the things that are involved in taking care of children and their families. To go back to that slide I showed with the multiple systems that the children and families interact with, working again with those various systems takes up a lot of time, in addition to whatever time a clinician is doing working with children and families directly. And so we're requesting that the rates for children's visits in Medicaid be increased, for behavioral health be increased by 35%. And so that would cost about $117.5 million. I know these numbers sound big, but remember, New York State has a $70 billion Medicaid program. And if you compare this to that, these amounts actually are not that large. And then the final piece, as I mentioned earlier, these two programs, the Child and Family Treatment Services Supports and the Children's Home and Community-Based Waiver Services. Those are relatively new program types, and they're very small. However, when they were started, the state anticipated much higher utilization of these services. And as a result, because that utilization has not become evident as yet or at all, the rates just don't even come close to reflecting what the needs are of programs that are set up to respond to and deliver these services. Not to get too much in the weeds, but a small program with inadequate volume, that still costs money for the provider. The landlord doesn't care in the clinic space where we're providing CAFTIS and children's ACBS services, whether our volume is high or low, the rent stays the same. And other supplies and services and salaries and other things like that don't necessarily change even if the volume doesn't materialize. And so we're asking for a kind of a volume adjustment to account for the fact that the number of children using CAFTIS and children's CBS has not come close to what the state utilized in developing its rate structure for these two programs. And that will cost another $44 million. So to get to the punchline, we're really talking about, for this coming budget year, about $195 million ask to allow the services that are needed by children and families throughout New York State to make them more accessible, to improve access, continuity. One of the things that happens when compensation and salaries for therapists and psychiatrists and all are not adequate is they may even take a job but quickly move away. So then you have discontinuous care. So what we need is a stable, robust, consistent service system that is able to respond to the needs that have been so eloquently expressed by my colleagues here on the call already. And so we really are looking for clearly the help of all the folks who are listening in on this in advocating for this request, which can make an enormous difference, not just in both the lives of the individual children and families that we've been talking about, but for the overall system itself. And providing services to children and families early in life can have an enormous positive impact on the life course. And often that is lost in policy discussions about the importance of children's mental health services. And often we wait too long to intervene And then things become much more critical and much more expensive, but that often isn't accounted for. So we're really looking for kind of everyone's voice to participate in our advocacy and see if we can make this happen. So thank you very much. And just to give you a little bit of insight, this is the kind of impact that these increases can ultimately have, which can have a tremendous effect on the long-term health and well-being of children and families across New York State. So thank you very much. It's really a pleasure to participate in this event, and I'll send it back to Carlos.
Yes, thank you, John. Really for highlighting the rate study that is behind our policy recommendation on New York State making this $195 million investment. I think for those in our audience, we also want to acknowledge that, depending on your connection to this area of work, these recommendations may feel complex, but we know that our children's behavioral health system is a complex system. And our approach in doing this study and developing the recommendations, which we have shared and I'll share again in the chat, is to make sure that we have a thoughtful approach to solving some of the systemic challenges in the state. And so, we are happy to answer questions. I know there was some in the chat already relating to this, and some of our speakers are responding to that, but we'll be sure to have those questions asked and answered during the end of our program when we have our Q&A. Now I want to move to highlight our second policy issue area around addressing discriminatory commercial insurance practices. And we have another member of our council, Tamara, here to share a little bit about the facts and experiences behind this policy area we are advocating for. So Tamara, I'll pass it on to you.
Good morning. My name is Tamara Bigel. I am a Healthy Minds, Healthy Kids Council member, co-president of Long Island Families Together, and lifelong disability and healthcare activist and advocate. I follow the lead of today's youth by truly owning my neurodiversity. I have lived experience with dyslexia, generalized anxiety, ADD, and narcolepsy. I am the parent of children with ADHD, anxiety, and are on the autism spectrum. This information has been shared with their permission. For the last 3 years, I have been providing testimony, raising the alarm that the children's mental health systems of care in the state of New York has crumbled, and children and families are suffering. One important way to address this problem is for New York State to hold commercial insurance companies accountable for their discriminatory practices that perpetuate and magnifies the problems with the system. There are so many examples of the ways commercial insurance has failed these families seeking mental health services for their children, keeping outdated, limited lists of in-network providers, arbitrarily limiting the number of visits with mental health professionals, lengths of stay in hospitals, and kinds of treatment, having different deductibles for mental and physical health care, paying providers way below operating costs, refusing to pay for higher level of care facilities, refusing to pay for both routine mental health care and specialist therapies at the same time. For example, individual therapy and family therapy, or trauma therapy and individual therapy. Refusing to pay for skill builders and in-home services for children with severe mental health disorders. New York State leaders must hold commercial insurance companies responsible for skipping out on mental and behavioral health care bills and leaving families without the services they desperately need. No longer should the government have to be the primary funder for higher level of care. All insurance companies must pay providers and the rates that allow providers a living wage and reasonable caseloads. Please go to our Take Action. Ask Governor Hochul and the state legislature to pass and enforce laws that will require commercial insurance companies to pay at least the same amount as Medicaid. By increasing commercial rates, our state can increase the number of providers so that individuals can find providers in their area and ensure that medical decisions are made by an individual's doctor based on the severity of the condition and not the company's bottom line, executive bonuses, and investor dividends. After a suicide attempt, a parent shouldn't have to spend hours going through outdated provider lists. Despite having providers in network within 10 minutes of my home, the only providers that came up in searches or when I called the benefit hotlines were over an hour away and had 6-month wait lists. Many of the providers on the list in my area had not accepted insurance for 5 years or more. Our time is better spent supporting our children, not chasing down false leads. My son had to use Medicaid insurance to cover his extended hospital stays, waiting for higher level of care facilities to have openings. He had experienced a parade of case managers and staff rotations because providers are not paid a living wage and quickly move on to jobs that are paid more. My son was lucky. He was placed in a residential treatment center. Mountain Lake Academy has the right mix of therapy while engaged in outdoor sports, a thoughtfully designed social emotional learning curriculum that highlights community and family rights and responsibilities, and a quality education with special educators that is Regents approved. This was a needle in a haystack find. Even they are not immune from the mental health staffing crisis. His reunification with us continues to be delayed. My son has been placed out of my home for 3 agonizing years. 3 years of his childhood has been stolen by the mental health system and their inability to give workers a sufficient wage. The lack of quality facilities and beds to treat my son means that he had to be placed 8 hours drive away from me. Families should not be separated for this long just to receive proper education and mental health care. It is barbaric. I am tired of seeing parents and grandparents attacked by children because they are on waiting lists for mental health care support. I'm tired of children dying because they couldn't wait for mental health services. I'm tired of families being ripped apart in order for services to be provided. As my son recently recounted, I feel like I'm treading water in the middle of the ocean and the rescue boat is never coming. 3 years is too long. We must act now to help children and families thrive. The transformation of children's mental health through Medicaid redesign enacted by former Governor Cuomo has failed. This transformation has in many ways decimated the children's behavioral health system, resulting in far too many families losing services, never receiving them, or receiving deeply inadequate care. OMH's response has been to launch new programs, wraparound and ACT teams, etc., every year that help the lucky few when tens of thousands are waiting. While these are good programs, we want a comprehensive plan that systematically provides these high-quality mental health programs to every child who needs it throughout every region of New York. We want children to have this mental health care where they live, learn, and spend most of their time. We need a thriving workforce in every region that is paid a living wage. Our recommendations today would get the state closer to that reality, including by requiring insurance companies to cover and pay their full share of children's mental health care. Act now by signing our Take Action. Implore our governor and legislature to enact the legislation, budget priorities, and policy changes needed to help our children thrive. Thank you.
Thank you, Tamara, for your really passionate and being a staunch advocate for not only your own child, but for children and families across the state. I think I want to echo what you are saying and encourage everyone in the audience to look at the chat, click on the link that we shared so that way you can take action and join our call, join Tamara's call as we write and urge state leaders to invest in children's mental health services. You can click on the link in the chat to complete the Take Action. It takes not even 30 seconds to fill out a pre-written letter that will go out to your state leaders and representatives. Now, I want to pass it on to our next council member, Bethany, to talk about our third preliminary policy priorities. around upstream investments in the workforce and COLAs. So Bethany, I'll pass it on to you.
Thank you, Carlos. Good afternoon. My name is Bethany Morgan. I too am a member of the Healthy Minds, Healthy Kids campaign, and also a New York State credentialed family peer advocate at a children's mental health clinic in Buffalo, New York. Children's mental health has always been extremely important to me. As an adopted child who spent time in foster care, New York State residential facilities, and later becoming a single teen mom who experienced domestic violence and homelessness, I dealt with depression, anxiety, and at times the feelings of wanting to end my own life. I always knew the system was broken. However, when my own children, and most recently my grandson, began to experience mental health and behavioral issues, and we were continuously running into roadblocks, I finally realized just how broken it really was. I myself am committed to enhancing children's mental health because through my lived experience, I have been on both sides. I was the child who needed help and did not receive it, the parent who through no fault of her own could not find the help for her children, and as a professional who now works in the field daily. I know that New York State children and families deserve better, and I am committed to making sure that we get it. Currently in New York State, children and families are suffering because there's an inadequate capacity to meet the behavioral health needs of young people. At the root of this problem is the reality that our state has failed to invest in the children's behavioral health workforce, and we are seeing and experiencing the effects of it. Psychiatric emergency room staff across the state are overwhelmed. They are seeing kids, discharging them within a few hours, handing families a piece of paper with some names and numbers on it, letting them know that the child needs intensive outpatient services. But then what? If we have a 6-month waiting list, that's not helpful for a family in crisis, particularly for a child in crisis. As a professional, I have personally had to inform families that there is upwards of a year-long wait list to see a therapist in my community. Or worse yet, a 2-year wait list for some autism and other behavioral health evaluations. Most recently, as a grandmother, I was told, now mind you, as a public school district was threatening to remove my autistic grandson from his kindergarten special education class, that there's a waiting list for ABA therapy. And he's low on the list because although he's being threatened to get kicked out of school, his needs are not high enough. The contradictions and miscommunications between school staff, primary doctors, behavioral health, and mental health staff due to shortages and burnout are concerning, and children are suffering. We are grateful for some of the investments that were made in last year's state budget, including funding for school-based mental health clinics, home-based crisis intervention, and high-fidelity wraparound services. We also know that our governor has shown that she does care about mental health and has focused on the $1 billion in mental health in the last year's budget. But what I think is clear from our experiences and that of thousands of families across New York State is that this money is not going to the children and family services, and it's not going to the workforce that is so essential to our state's ability to meet these children's needs. There are enormous vacancy and turnover rates for providers. Despite incentives, there are still challenges recruiting and retaining staff, and even longer-term challenges in getting new professionals into the pipeline, especially BIPOC and multilingual providers. I personally have had to recently think about leaving a 10-plus year career that I love because I can no longer afford to survive on my wages. We can no longer ignore the fact that all of these things are impacting patient care and in turn hurting children and families. We need to both invest in the workforce we have now, as well as invest upstream in building the upcoming workforce. This includes building up peer support. I'm a huge supporter. It works. First, we at Healthy Minds, Healthy Kids support a 3.2% cost of living adjustment for behavioral health providers, one that is tied to inflation, so professionals continue to receive COLA as costs rise. This will help us support and maintain a workforce that is already stretched thin. Second, we need to expand funding and eligibility for new and existing recruitment and retention strategies, particularly those supporting BIPOC and multilingual professionals, including through loan repayment, tuition remission, scholarship programs, increasing residency, fellowship positions, and employee assistance grants. This will help us build up the pipeline of professionals. We cannot do this alone. We need your help. I hope after today you will take action and join our digital letter writing campaign that will be sent to state leaders across New York State. Thank you for your time.
Great. Thank you, Bethany, for really highlighting for us our third preliminary policy priority recommendation and really sharing your experience both as someone who has worked in this area in the state and is also a parent and a person living through a variety of these issues as well. Again, as Bethany mentioned, you can join our call to action and complete our letter writing campaign to state leaders. In a moment, we'll reshare that link in the chat. But without further ado, I want to pass it now to two more of our council members, Kathy and Nora, who will highlight our fourth and final preliminary priority around school-based mental health supports. So Kathy, I'll have you lead first.
Hello, everyone, and thank you for joining us today. I'm Kathy Salazar, and I'm a member of the Healthy Minds, Healthy Kids Leadership Council in the Southern Tier of New York. I'm also an adoptive parent of teen children from foster care, and both my boys have disabilities and have trauma issues with trauma that have caused mental health issues for both. I also have grown children that are in their 40s, have grandchildren that are actually older than my two new kids. And we've experienced over the years a lot of issues with finding care for our kids. You know, I've had additional foster kids, and even with resources, financial resources, it's tough sometimes to find the help that the kids need. But I've dealt with many mental health issues, trying to find help for kids that are in crisis or that have long-term needs that need to be addressed. Lately, I've been advocating for schools, and I've been visiting local schools in the area to kind of talk to them about what they're doing to help kids. I've been advocating for teachers and staff to have trauma training and learning skills that can help them to handle problems in the moment, as well as learning about available resources in kids and families so that they can get the help that they need long term. Schools are where our kids are during most of their awake hours. They're exposed to many different people every day. And if those people were trained and focused on a vision of health and wellness for the children, and if we have the ways to connect the children to the services they need in schools and communities, schools would be able to properly identify and address problems with the kids. The hope is that, like some of the earlier speakers have said, the hope is that we can get these children identified early when it's most effective and when it sets them up for a better shot at life as they get older. School's the place where many issues surface for children. And those issues are often misidentified as like behavioral problems, bad kid in school, you know, those types of things. And what that does is it sets kids up for discipline, suspension, and expulsion. And that even happens to kids in school as young as kindergarten. We assume that our school personnel are well-trained, that the staff knows what's going on, that the teachers know, and that in school mental health people know what's going on with the kids. But the fact is that they really don't. You know, a lot of times, like I said before, it's behavioral problems. It's considered a behavioral problem instead of a kid needing help. So many school personnel say they're trauma informed, and when I ask them to define that term, they really don't have an answer. That's because most teachers, most school personnel have received very little training and formal education in the areas of childhood trauma and mental health issues, specifically dealing with kids. And it's not mandated for them to know this stuff. Too few schools have adequate mental health resources available to students, such as school psychologists, counselors, social workers, and mental health clinics. However, even those schools that do have the resources do not always use them effectively or have limited training in trauma and mental health issues, specifically around kids. Sometimes they're also not aware of resources in the community to help families and kids long term. So training and awareness is so important, as are targeted mental health services that can support the specific needs of students. Those services can be provided in schools. Recently, I took a look at a school budget, and that's actually what got me started looking into how we can help the situation with mental health care for our kids. And when I realized that in my small schools district, $1.2 million was going to school psychologists, social workers, and counselors, I realized that. And then when I actually went and met some of these people and spoke to them, I realized that they really all had a different idea about what their jobs were. Nobody was working together, and there was no focus in the situation. So training and awareness are very important. Like I said, to support our students. They're there every day. These people see them every day. These services can be provided in school. Rather than selling for trauma-informed schools, let's look at trauma-responsive and healing-centered schools. The difference is training, readily available resources, and focused care by professionals already in the school. In addition, partnering with other agencies and community-based organizations will help build a strong foundation for our kids' mental health. But the state needs to step up with resources. And to speak a little more about that, I'm going to turn this over to my fellow council member, Nura.
Thank you so much, Kathy. My name is Nura Anwar, and I'm an educator and public health practitioner in the field of pediatrics, early childhood development, and mental health. I also am a Healthy Minds, Healthy Kids council advisor from the New York City area. As an educator myself, I resonate with Kathy's insights about increasing training resources for school personnel and building a better mental health supportive environment through trauma-responsive and healing-centered schools. We are now at a point where raising awareness about the problem, discussing the size of the problem, is no longer a priority, but rather finding ways to transform our proposed solution into reality through funding is highly critical and time-sensitive. There are so many additional investments needed in schools, but an area we would like to see in this year's budget is a doubling of funds for something known as the Student Mental Health Support Grants in Schools initiative. Last year, the state budget heard students, parents, and teachers calling for more mental health resources in schools and took action by adding $10 million per year for the next 5 years to create the Student Mental Health Support Grants in Schools initiative. This grant program offers a limited number of schools flexible 5-year grants to implement school-wide approaches to support student mental health and well-being. However, out of the over 250 eligible school districts, less than 30 schools will receive this funding. We call on the state to double their commitment towards this important investment so that another round of school districts can enroll. Our students can't wait. As adults, while we maneuver through the daily demands and stresses of the New Yorker life, we may overlook the battles that our children face, and it may seem as though they are only children and won't have to deal with adulthood until much later. However, our children are our future, and if we don't support their mental needs from an early age, their mental health conditions may worsen and debilitate their trajectory in life. The sooner we intervene and invest resources, finances, staffing, and supports toward improving our children's mental health, the greater the positive impact we can have both immediately and in the long term for our children who, let me remind you one more time, are our future. Thank you.
Thank you, Kathy and Nora. So again, to reiterate, these preliminary priorities and recommendations focus on calling on our state to invest in $195 million as detailed from the rate study that John highlighted for us here. Our second preliminary priority is around addressing discriminatory commercial insurance practices, with a third one on upstream investments in our workforce, including issues around COLA, and as you heard just right now, making sure that we as a state and our leaders supporting budget changes in the future, including this coming year, ensure that there are adequate school-based mental health supports for our children, youth, and families. Again, if you haven't had the opportunity to complete our Take Action and write to your state leaders, please take the next 30 seconds, 60 seconds to fill out the form that is linked in the chat. It is essential that we all mobilize as a state, as parents, as advocates, to ensure that our children and youth have the supports that they need. To hear and really emphasize what you have heard throughout our Community Speak Out event today, I now have the privilege and the honor to introduce to you our next council member, Christina, who will really highlight again and drive home for us what is at stake through a quite personal experience, but nonetheless an experience that we all rally behind and support Christina around. So Christina, please take it away.
Hello. First, I want to apologize. I know I'm having some computer glitchy issues, but I want to try to keep my camera on for a little bit. So today we are speaking. Cody, my son, was actually going to speak today and share his story, as he wanted to be the one to share it as the youth that is currently going through our system. But unfortunately, he was unable to. So now you have me. But my name is Christina Hartman. I am the parent of a 16-year-old biracial son named Cody. Some of you know us, some of you have heard our story. But not only am I a parent, I work as a New York State certified family peer advocate. In a moment, I'm going to share our story. While I do so, please remember what is at stake here. The facts, the statistics that you heard today, and the personal experiences with New York State's mental health system that you heard up until this point. Cody and I both joined the Healthy Minds, Healthy Kid Council in hopes that his story can help change the broken children's mental health system, and that others will not have to endure the years of trauma that he has because of the lack of proper mental health care and treatment. His story begins at a very young age. He received his first mental health diagnosis and was placed on medication at just 3 years old. His first inpatient psychiatric hospitalization happened when he was only 4 years old. That would be his first inpatient psychiatric hospital. A 4-year-old should not have had to go into an inpatient hospitalization. Instead, he should have received proper outpatient care. By the time he was 9, he had already been handcuffed and taken in the back of a police car 12 times. 12 times too many. 7 of those times were from his elementary school. Had there been school-based mental health supports and proper training, this could have been avoided. Children 6, 7, and 8 years old should not have been taken away in handcuffs from school in front of their peers. This is not only traumatizing, it's detrimental, and it's simply inexcusable. I worked endlessly trying to get Cody proper outpatient supports. Working as an advocate, I have many connections, yet the services weren't and still aren't available. Agencies could and cannot hire and retain staff due to the low reimbursement rates, which then led to low salaries. Due to the lack of proper services for him to remain home, he wound up going to a community residence and then from there to a residential treatment center. After 2 years in a residential treatment center, Cody was able to return home. He was 12 years old, discharged home to home and community-based services. However, those services were nowhere to be found. Cody sat on wait list after wait list. While on wait list for home and community-based services, he had his first suicide attempt. I believe if he had the services he needed that were deemed medically necessary for him, he wouldn't have had that attempt. He had 2 more suicide attempts after that while sitting on wait list. And you guessed it, after being home for over 4 years, he still lacks his medically necessary mental health supports. From the time Cody was 4 up until April of 2022, Cody had 20 inpatient psychiatric hospitalizations. The majority of these could have been prevented had he had proper services at home and in the community. The truth is, these hospitalizations do not teach him how to cope and utilize skilled techniques when he's at home. This is why it is so important for youth like him to have proper care and have his home and community mental health supports. Also, by him being in an inpatient bed due to lack of home and community support, he's taking away a hospital bed from a youth who so desperately waits on lists for inpatient placement. How is this fair? But wait, should we even mention the cost of these unnecessarily inpatient hospitalizations? These costs alone could be paying fair wage to our outpatient workers and allowing our children to remain home where they should be. Not only is he going through this, but he is watching so many of his friends, and I am watching so many of my clients go through the same thing. Suicide is real, and like Cody, so many of our youth who have attempted suicide or those have actually succeeded in committing suicide have done so while waiting for mental health services and the help that they need, deserve, and are entitled to. This needs to end. Our children deserve to receive school-based mental health services. They deserve not to be sitting on wait lists due to workforce shortages, and they deserve proper care regardless of insurance carrier. This is a statewide crisis. The suicide rate amongst our teenagers is rising, and we cannot blame providers, agencies, educators, or parents for killing our kids, but we can blame New York State and the broken children's mental health system for killing them. So please make sure to reach out to your elected leaders and take action today. This needs to end now. Enough is enough. We cannot continue to allow New York State and this broken children's mental health system to destroy our children.
Thank you, Christina, for sharing your story and Cody's story. We wish he was here, and we're sending our best to the both of you as you continue to grapple with the challenges that you're facing in your lives and through the system. But know that we're here to support you both, and we have built this community in part to make sure that parents and families and young people like you and Cody have the support and this the system in place, so that way we can get to that place where you are thriving and other families are thriving. And from me, sincerely, I continue to admire and really appreciate how the both of you are committed to this work, and we're always standing with you, and we will always be standing with you. So thank you, Christina. So now, as we get ready to conclude our event, I want to pass it along to one of our newest council members in our group, Steve, who will highlight for us ways you can mobilize and take action and continue to be a part of this journey with us and be a part of our efforts to advance these priorities and the causes that we've been advocating here today. So Steve, I'll pass it to you, and I'll also share my screen for the audience.
My name is Steve Gagne. I'm in the Utica Rome area. I'm glad to be a part of this council in so many different ways. I look at the personal experiences of all these people ahead of me, and I've lived it also. My son's autistic. He's also has mental health issues, but he's an adult now. He didn't get services for many, many years because of the dual diagnosis and them not even know what autism was years ago. I've had great jobs. I look back, I owned businesses. I was manufacturing management. I gave all that up to advocate for my son. And then what happened is I wound up advocating for others in our area. And so I'm a therapeutic foster parent right now. We currently have 8 children in our home, which is more than we normally have. But the reason is because not a lot of foster homes take autistic kids, and many do not take any children with mental health issues. And those children that we have, and I lived this with not just with my own kid. Now I'm living it with children that aren't ours. And we're on 18-month waiting lists for 2 of our little ones right now. We're seeing kids come into the system much younger with mental health challenges than we've ever seen. We've been doing this a long time. It used to be the teens. It's not that way anymore. They're coming in, and the services need to improve to accommodate that. So what my take on all this? It's time for action now. It's been long enough. This is our window of opportunity, I think, to get some of this stuff done and to take action. As you saw and heard from people, previously to me, the parents, caregivers, and advocates, they're ready to take charge and make sure we put a stop to this mental health crisis. Even more importantly, we know we can't do this alone. Your voice is essential to us succeeding in putting pressure on state leaders to support these and other issues we raised today. Here's how we should do it. Take action, like Carlos mentioned. Look into the websites and send in those pre-written messages to our state leaders to and complete it by taking this action letter writing campaign online. And like I said, take action. Do it for I look back at Christine as I've only known her briefly, but her story is compelling. And there's many Codys out there. And I think it's important that we do this action now. You sign up for our newsletter, launching this December as we begin to mobilize for the budget. Children, youth, and families need. You'll learn about resources from us and our partners, connect with the community and network we are building, and stay up to date with our latest advocacy. And finally, stay connected to our campaign, know what we're trying to do here, our council, and opportunities to be a part of this change by following us on social media. You can follow and tag HMHK's new Twitter and Instagram accounts at HMHK Campaign, also linked on the screen and chat. Once you follow, please share our take action so your friends, peers, and families can also support our call to action and join us as we advocate in Albany. You have the power to help us build the momentum we need to make change happen. Thank you again for taking the time out of your day to be here, and we will open our community speak out soon. I just wanted to add one other thing. I believe that I'm not a person that I just don't like to say the system is broke, which I did for many years. It's time for solutions and in action. And one of the things I did yesterday, because I'm so interested in this program, in this council and in the mental health part, that I belong to New York Alliance for Developmentally Disabled that has 12,000 parents and members in it. And I'm going to see if we can do something with you guys, with that group, to help you guys get 12,000 more signatures. So I'm taking it back to you, Carlos.
Thank you, Steve. And again, please join our campaign and support not only the advocates that you met here today, but other families and caregivers that are experiencing similar stories across our state. Before we get to our Q&A, I want to pass it just to Brad Hansen, who's director at Families Together in New York State, another key partner in the Healthy Minds, Healthy Kids campaign, to share a quick update and some thoughts related to an upcoming event in 1 hour. Go ahead, Brad.
Thanks, Carlos, and thank you everybody so much for being here today. Thank you for all the speakers. You really did uplift what we've been saying. We'd like to say in the past year, but we've been talking about this for over a decade. I've been working at Families Together and leading our state policy and advocacy efforts alongside our network and impacted parents and youth leaders for over a decade now. And in this role, you do a lot of listening. Every year, the conversation has grown more desperate. The urgency is more dire. Students have been talking about their mental health. Parents have been talking about their children's mental health. Grandparents, communities, educators, peers, clinicians, lawyers, pediatricians, even U.S. Surgeon Generals, but not governors. I've observed enough legislative sessions to know that mental health was a rare mention in a New York governor's State of the State. Even rarer, the mention of children. The silence was deafening. That is, until now. Governor Hochul is listening. She's contributing to the public discourse on youth mental health, and she's making historic investments, for which we are grateful. There's never been more hope. that we are witnessing a turning point for children's behavioral health services. We have to make this point loud and clear. What she did last year is good, but not enough. And that's what we've been saying today. So just to reiterate Steve's point about take actions, do them. Please participate. Sign up for our listservs. Be a part of this coalition. Be a part of this campaign. And just today at 2 o'clock, you can join virtually. OMH, the Office of Mental Health in New York State, is hosting a public town hall. You can continue this conversation there. You can support speakers who will be making all the same points and more. Be a part of the movement. Join that call today at 2. Thank you.
Thank you, Brad. So now we want to spend a few moments. I know we're a little bit over time for this event, but some of our speakers have graciously agreed to stay on for a couple of extra minutes, so that way we have some time for audience Q&A. Again, for reference, this event has been recorded. We will share it for all who have registered, as well as the link shared and the resources provided, so you can take action and join our campaign and be a part of the movement that we are building here through this initiative. Brad also just put in the chat the link to the town hall. That is 2 p.m. And I want to just say I'm incredibly thankful for all of our speakers here today, all of our partners, our parents, our advocates, who on a daily basis continue to work tirelessly for families and young people across New York State. As you heard, are facing a lot of severe and daily challenges that we as a group know we can make a difference and can make an impact towards. So again, thank you all for being here. We'll spend some time now with some Q&A. Please take action, which is linked in the chat. And if you have any questions that you would like to ask our speakers live or about any of the issues and policy preliminary priorities we shared, please raise your hand or type it in the chat so that way we could ask our speakers. So I will go now. I see Marilyn. I hope, I know your hand has been raised for a while. I'm going to unmute you, and hopefully there's a question you would like to ask, or if you'd like to provide a comment, feel free to do so. You should be able to speak now, and then we'll have James after Marilyn. So Marilyn, you should be able to unmute yourself.
I only want to sincerely thank everybody who's been part of this. It's been amazingly heartfelt, compelling, and if this doesn't move people, I don't know what would. You know, I'm wondering if this recording actually gets sent to OMH. He says is following right now.
Yeah,
Will they, you know, because.
Yeah, thank you, Marilyn. I think, you know, this recording is definitely going to be public. We are also providing testimony to this OMH town hall. I'm sure we can send this recording and have been preparing to have conversations with them around the rate study, among other priorities that we highlighted here. So yes, everyone and anyone that needs to get this is going to be hearing from us.
Yeah, no, and kudos to you know, particularly you and Alice, that I know personally, but every single person, you just want to hug them so hard for what they've been through and what they do, and on so many levels. You know, it's just really incredible.
Yeah, thank you.
Thank you all.
Marilyn. James, you should be able to unmute. Feel free to ask your question.
Hi, good afternoon. I'd like to thank you all for this event and thank all the speakers for sharing their views and perspectives and experiences. I wanted to ask, has Governor Hochul said anything or have done anything that would indicate that she is willing to put more funding to increase the salary and the pay of workers for people who work in this field? Because I know I myself work in this field, and the pay is absolutely atrocious. And if we have people who want to go in this field, they'd be even more encouraged, I believe, if they could actually have a livable wage working in this field.
James, I can address some of that. I think going back to Brad's comment, I mean, I think the really hopeful thing is, as Brad said, we do have a governor who's very much on the record indicating her support for mental health, including youth mental health. But I think your point is spot on, which is we need to make sure that those investments are going to the youth side and that they're going to things that support a workforce that's adequate to serve children. That includes issues like cost of living adjustments and salaries. And I think that's in part really what that rate study that we talked about is trying to get at, is saying we know that a lot of what's driving the inadequate pay or the lack of support for our workforce is just this really inadequate rate system. And so that's in some ways really our push to try to fix some of those systematic issues. And so I think what we're hoping is that we take that interest that we have from the governor and we really direct it at what we view as the core issues, which are issues around workforce, which are issues around investing as early as possible in children so they don't become adults who also can't get the care they need. So I think we're really hopeful, and this kind of echoes what Brad said, is that we can really push to say, this door is open and we've identified where those investments need to go in order to actually address these really critical issues that are leading to children being on wait lists or going without care at all.
Thank you.
Thank you, James. Next, we have Kyle. Kyle, you should be able to unmute yourself and ask your question.
Yes, hi, everyone. Good afternoon. Thank you, everyone, so much for sharing your stories. They truly do have value, and they truly do inspire me and others as well to continue this good work and the good fight, advocating for mental health reform and for the thriving and well-being of our kids. So my question goes hand in hand kind of with the previous question, and that is, pay is obviously a big barrier and a big factor. This is as somebody that works in the mental health field, it's incredibly draining work. It's incredibly rewarding work, but it is incredibly draining and requires a heavy support system in order to truly give kids, truly give clients the care that they deserve. So pay would definitely ensure that good quality, high quality services can continue to exist and be administered to our kids. Another barrier is something that I myself have experienced. I too have, mental health diagnoses ever since, being in high school. I've had anxiety and ADHD, and my recovery journey has been nonlinear, but it has still been existent. I have been resilient to my adverse experiences. And as such, I really gained a sense of purpose to try and relay the messages in the way that I was able to be resilient to our youth and to others. This was a big reason why I entered the mental health field to begin with. But to go on to that next step, and to be either a social worker, a mental health counselor, there are still barriers to even take that next step to advance as a young person wanting to be a professional in the field, and that being the high cost of education to get the degrees necessary to administer these services. I believe there's only one scholarship incentive program, but it's incredibly conditional and it's incredibly restrictive. You have to stay in New York State for 5 years after you graduate, which, it's always good to plan in advance, but I mean, to lock yourself into something for 5 years, I feel like is unnecessarily restrictive. And it kind of limits our workforce development and the potential of people like me that have shared, stories to share and value to truly connect the patients. They're unable to do so. So my question is, what is Governor Kathy Hochul and the state legislature doing to lower the cost of education to continue to get the degrees necessary to administer good quality mental health care in New York State?
I will ask to see if any of our speakers will want to take that first.
I definitely can, but I'll pause to see if somebody else wants to take it first.
Alice, why don't you go, and then we'll see if anyone else wants to chime in.
Sure. So I think it's a great question, Kyle. And I think we have seen in recent years, various kind of tuition remission or scholarship support programs, not just, some that impact the mental health space, but also in healthcare generally in other areas. And I think that's why, one of the priorities that Bethany talked about is really in investing in those upstream workforce support. So like it's almost like you need to stop the hemorrhaging now, which is that we just have this deeply underfunded system and we need to invest in, current workforce, current rates, all of that. But we also have to look to the future of how are we going to get more people into this, as you said, challenging, but also deeply rewarding profession when maybe they don't see a great future for themselves there. And so, one of the recommendations we have is around, more investments in those upstream supports like tuition remission, scholarships, loan forgiveness, residency positions. In terms of, where Governor Hochul will land on that is to be seen. And that's part of, I think, the advocacy that we want to be doing in the coming weeks. I think there's been some things in the past year and the years before that can be built on. So it's not like we don't have any investments in that area. It's just that we know it's not enough for the depth of the need. So I would just say that should be part of this advocacy as we kind of flagged this, is really uplifting the need to make those investments. But I know Kathy has her hand raised, so I'll turn it to her.
Yeah, I was just going to follow on what you said, Alice, and say that I remember one of the priorities last year and some of the talking points that we had. One of the main ones is how the money gets allocated and then it's deferred. In other words, it's not paid. So I think that everybody with a stake in this should be able to know that could happen. Even though money's budgeted, it doesn't necessarily mean it's going to go where it's supposed to go, and that everybody kind of work towards holding their local people accountable and reaching out to the governor when she makes these things that, where she's issuing money or saying that she's going to support something and holding her to it. I think that we could all maybe reach out and make sure that does happen, so it's not money that's lost again.
Okay. And I think with that, just to be respectful of the time of our speakers, and I don't see any other hands raised or questions in the chat, we are going to be concluding our Children's Mental Health Community Speakout. Again, I want to give a round of applause for all of our speakers and our partners that made this event a reality, and really for all of you that have joined us here for this event, showing up, connecting and being a part of our movement, completing our Take Action, and being advocates with us to support definitely a worthwhile cause that we will continue to fight for, advocate for, and ensure that we will accomplish this and many more achievements in our work to really help families and children thrive here in our state. So thank you again for all our speakers, for our audience members. We appreciate you and will hope that you continue to join us as we move into state budget advocacy this winter and into the new year. And we're excited to have you with us in our next step. Again, we will share a recording, we will share these links, and we hope to see you soon. If you would like to connect with us, our contact information is also provided in the chat. And we'll be sure that information is in our follow-up email to you all. Thank you again, everyone. Thank you for being powerful advocates, and to all our speakers. I will see you soon and hope you enjoy the rest of your afternoon. Now on to the OMH Town Hall.
Bye, everyone.
Bye, everyone.
Bye.